Good morning, students. Hope you are doing all good. I welcome you all to today's session for the NPTEL online certified course on the topic An Overview on Maternal Health, the Antenatal, Intranatal and Postnatal Care. I am Dr. Barnali Ghosh, an obstetrician and gynecologist working as assistant professor at Viceroy Multispeciality and Medical Research Center, IIT Kharagpur. So, today we are going to discuss regarding comprehensive abortion care, right? And also the discussion will be regarding the MTP Amendment Act, which have been recently amended in the year 2021. So, the concepts to be covered are the comprehensive abortion care, the different guidelines related to medical termination of pregnancy, and what are the changes that has been incorporated in the 2021 MTP Amendment Act. The keywords are as given. So, coming to comprehensive abortion care, right? So, abortion is a health care. It is a right of the woman, and abortion, if the client or the pregnant mother, right, if she wants to terminate her pregnancy based on grounds, then it should be the abortion practices, safe abortion methods should be made accessible and affordable to the pregnant mother or to the client. Okay. So, what are the guiding principles? Each client should have the right access. They should have the right access, very important. Unsafe abortion practices should always be prohibited, because that will lead to a series of complications in the form of sepsis, in the form of hemorrhage, in the form of injuries to other internal organs, which ultimately lead to laparotomy, and sometimes we may lose the mother. So, the client should have access to right abortion care practices, and a good history should be elicited from the client, and they should be evaluated individually regarding the method of abortion to be implemented on her. Very, very important is the counseling portion, which is an integral part of that of the CAC or comprehensive abortion care. Next is compassionate, being compassionate and giving non-directive pregnancy options. Sometimes she will come and ask the care provider whether she can continue her pregnancy in certain scenarios. Say she is having certain disorder or certain pre-existing health conditions which can jeopardize the life of the mother if if she is pregnant, and ultimately if it goes to the later stages of pregnancy. So, you have to inform her regarding the complications, how to combat the complications, and give a non-directive pregnancy option, right? And then let her decide. Privacy is very, very important to be maintained. If she decides for an abortion, the name, the particulars should not be disclosed to any other person by the health provider except to the authorities, right? Authority in the form of police, or in case you need to inform the police or the authorities, right? But the care should be provided. The abortion care should be provided to the client. Okay. So, privacy and confidentiality should be maintained. Post-abortion care, very, very important. Post-abortion care in the form of family planning, right? So, counseling regarding the contraceptive methods which are available, and to help her decide to avail these methods which is most suitable for her, that should be counseled to the client. Legal evidence of defilement, rape or incest is not required in order for the client to obtain an abortion, right? Just the client word is sufficient. If she comes and asks for an abortion based on certain grounds, then the health provider or the doctor, the examining doctor is is liable to provide her the services. So, this is the whole scenario of the comprehensive abortion care, which will include the foundational, the information, the abortion regulations, the different services, the pre-abortion counseling, as well as the options for abortion methods, right? Then the abortion procedure itself, post-abortion care, and the different counseling about the post-abortion contraceptive methods should be discussed with the client. Okay. So, coming to the abortion services, unsafe abortion is yet a significant but a preventable cause of maternal death. So, you have to decrease the rate of unsafe abortion. Though in the year 1971, so since 1971 this MTP Act has been legalized in India, still there is a challenge, because to avail, to access the services of MTP, right, by the mothers in the remote rural areas of the country. And so, the CAC, the Comprehensive Abortion Care Services, are now an integral component of the efforts of the Government of India to bring down the maternal mortality and morbidity in the country. And you need to know that approximately 8% of the total maternal mortality are due to unsafe abortion. So, 8% of the total maternal mortality are due to this unsafe abortion practices. So, what are the factors which are leading to these unsafe abortion practices? Number one are the social factors. There is lack of awareness regarding the legalized MTP services, right, and the proper places where these MTP services are being given to the mothers, right. Also, social stigma relating to this abortion of a life. So, that is there. So, they try to conceal, most cases the couple try to conceal this abortion total, and ultimately they land up in unsafe abortion practices. Sometimes abortions are done due to gender discrimination. There are multiple decision makers for that female in her home. So, all will be giving different decisions. Okay. Also, ignorance about contraception, and most of the times the male partner is is least likely to get involved in this whole process, and women's have a inhibition to go to the male providers for the MTP. So, they land up in unsafe practices. Policy factors. So, there is scarcity of policy providers, there is inadequate equipment and supplies, the MTP kit is sometimes not available in rural or remote parts of the country, and also when they come to the care providers, to the facilities, to the government hospitals, we try to insist them to use certain contraceptive methods during or after their abortion, and that is not well taken by most of the families, right. Also, in case of any complication, there is weak referral or weak system of transport for referral of that mother to higher center. Coming to economic factor, yes, charge is more, the kit has certain charges, but they need to know that it is given free of cost at government hospitals, right. And sometimes if they go to a private doctor or some private providers, they will charge a high fee for the services which cannot be afforded by the couple. Physical access factors, what are they? Scarcity of trained providers in the underserved areas, judgmental attitude of the providers, it should not be present. The providers who are giving the service, they should not be judgmental for that woman, right? And also the sites where these safe practices are being provided, they are not advertised, and the couple or the female does not know, right, regarding, have no information regarding these places. So that was the causes which have been playing, or which are present in the society, and that are increasing the rates of unsafe abortion practices. So we need to stress upon the MTP Act which has been legalized, and who are destined or who are given the authority to terminate a pregnancy. He or she must be a registered medical practitioner, right, who possesses a recognized medical degree, right, as defined by the Indian Medical Council Act. So, should be a registered medical practitioner, and if he or she is only a MBBS doctor, then he or she should have an experience of housestewardship of 6 months, right, at least 6 months or 1 year of housestewardship in the gynecology department, right, and have assisted or done herself or himself the MTP practices during this training period. Or if the practitioner is already experienced or trained in gynecology and obstetrics, maybe she or he has a master's degree in gynecology, MS or MD, or a diploma, DNB, or a diploma in gynecology, then he or she is also authorized to go for the MTP services to the population. Okay. So, they are given the license. Now, coming to the consent requirement, very important, consent requirement in Form C, the consent of the woman is sufficient, but if say she is a minor or a mentally ill woman, then the consent of the guardian. Consent of woman, but if in case she is a minor less than 18 years of age or she is mentally ill, then the consent of the guardian is required, and it should be documented in the Form C. Now, say when you are going for MTP services for minors less than 18 years, right, and then it comes under the POCSO Act. What is POCSO? Protection of Children Against Sexual Offences. So, under this POCSO Act, what is to be remembered by the healthcare provider is he or she needs to report to the concerned authority regarding this MTP being done in a minor. And sometimes there is no need to go for an FIR filing by the doctor, or there is no need to go for any legal proceedings by the doctor, but he or she must always document and report to the police, right. So, he must report, at least report to the police regarding this episode or this case, and that reporting will not hinder in the provision or in providing the health care facility, the MTP services to the minor, right. So, only you have to report to the local police regarding MTP in a minor, because it comes under the POCSO Act. Rest, whether to go for FIR, whether to go for any legal proceeding, that the family members of the girl child or the police will decide. That is not to decide by the doctor. And number 2 is in between this reporting, all this documentation, you will continue with the MTP services. Next is where can be done. Where can a pregnancy be terminated? It can be done in any government setup. It can be done in a place which is approved by the government or district level committee, which is constituted by the government, and this district level committee contains a chief medical officer as the chairperson of the committee. So, this district level committee constitutes of a gynecologist or surgeon or anesthetist and other members from the local medical profession, non-government organization and Panchayati Raj institution of the district, right. And one of the members of this DLC will be a woman, okay. And this DLC is there to serve for the 2 calendar years, okay. So, the place where the MTP is being done, it should be a government affiliated center or in a place which is approved by the government or the DLC, and there the that is authorized, that has the license to perform the MTP services. And what services, what type of method to be implemented? If it is an early pregnancy up to 7 weeks, then we go for medical termination of pregnancy. And how we do that? With mifepristone plus misoprostol. Okay. So, mifepristone and misoprostol is prescribed by the registered medical practitioner, maybe at his or her clinic, but she should have access to the place which has the license of these medical which has the license of your pregnancy termination services, because sometimes the medical methods fail and we need to go for surgical methods, okay. So, why a place? Because here she or he, the registered practitioner, will go and if required may need sometimes surgical exploration if the medical termination fails, right. Or say if it is more than 7 weeks, then also medical termination sometimes is not complete. So, that times also we go for surgical exploration in the form of manual vacuum aspiration or D&E under your sedation, dilatation and evacuation. We go inside the uterus. This is the the nidus or the fetus, that embryo sac, right, the gestational sac with the embryo and the developing yolk sac. So, here we go inside the uterus and we take out this sac. We take out this sac. This process of doing is called as dilatation and evacuation, which is done under sedation in a OT at a place which has the license to perform the medical termination of pregnancy services, not medical. These are all coming under the surgical exploration group, okay. So, this is the picture of the MTP kit, which also comes as Mifegest kit, which has one mifepristone tablet which is 200 milligram. This is the mifepristone, and 4 misoprostol tablet, each of which is your 200 microgram. So, you take the mifepristone tablet on day 1 today, and after 48 hours you take these 2 misoprostol tablet, that is on day 3, that is after 48 hours orally, and the rest 2 of the misoprostol tablets are taken per vaginally after soaking the tablets, also on day 3. So, this is the protocol to be maintained, and this is the medical method of abortion which is done in early pregnancy, that is less than 7 weeks of gestation. Now, coming to the documentation part, it is mandatory to fill and record the information of the abortion crisis performed by any technique, may be medical or surgical, in the following forms, of which the very important is the form C, which is the consent form, which is to be filled by the woman herself. Form 1 is the medical practitioner opinion form regarding the cause of abortion that is being performed, the type, whether it is medical or surgical, the weeks of gestation at which the abortion is being planned. So that is in form 1. Form 2 is actually the reporting form, monthly reporting form, which are to be sent to the district authorities, and ultimately the form 3, which is the admission register, to be maintained by the institute or the place where the abortion practice is being done. So here the admission register should be maintained, and it should be kept for a period of 5 years. Right, that document should be kept for a period of 5 years, and for further any case, if there is any legal proceedings, then these documentation is very, very important. So this is the form C, or the consent form, which is to be filled by the mother. In case of minor or mentally ill woman, it is to be filled by the guardian. This is the form 2, which is to be for just for reporting, monthly reporting, right. So all these you need to go, and that is an audit, number of cases, number of abortion cases which are being done in this place. Then the period of gestation at which the abortion is being done, why the abortion is being done, reasons for termination, and ultimately after termination whether the client is willing to accept or to practice the contraceptive methods, right. So whether she is using sterilization or intrauterine device or any pills or DMPA injection. We have government supply now, government supply in the form of Onthora injection. So all these are contraceptive methods which need to be counseled to the woman, which need to be educated. You need to inform the woman, right, lay down the options available in front of her and let her choose. Now form 3 is actually the admission register, which is to be maintained by the institute, right, to have the documentation regarding all the details of the woman, and it is to be maintained for a period of 5 years, 5 calendar years from the date of the from the date of the surgical exploration or medical abortion. So that was regarding the form, the criteria, the different documentation required to be done at the institute for the abortion care practices. Coming to the comprehensive abortion care, it has 3 areas of interest. Number 1 is the health facility preparedness in the form of availability of drugs, equipments, trained providers, and then we need to train the providers. We need to have a pool of MTP trained providers, right, giving them training regarding this methods of MTP practices, and ultimately developing manuals, training packages, booklets and other information, education, communication materials. So different booklets, different manuals are distributed throughout the community, throughout the rural areas, the remote areas, just to inform the woman, right, or the health seekers, and so that they can come to the health facility and avail for safe abortion practices. So that was regarding the comprehensive abortion care. Now coming to the abortion law, which deals with the amendments which have been done in the recently in 2021 in the MTP Act. So that this is the MTP Amendment Act, right. So this was after the Honorable President's assent, the MTP Amendment Act 2021 was notified on 25th of March 2021, and these are the changes which has been incorporated, right. We will come to them one by one. Just in a nutshell, I want to say the points. Number one is, if the abortion is being done at a period of gestation of less than 20 weeks, then the consent of one registered medical practitioner opinion is sufficient, only one. If say the pregnancy has crossed the 20 weeks. So, if it is 20 to 24 weeks of pregnancy and abortion is being done during this period, then opinion of two registered medical practitioner is required, right. Why it is being done? To note the cause, you need to have two opinion from two registered practitioner, and here previously the upper limit of gestation was 20 weeks for abortion. Now it has increased to 24 weeks, okay. And number 3, so 20 weeks has been increased to 24 weeks. So these are the changes which has been made. Number 4, what is that? That if in case there is any fetal anomaly, so that fetal anomaly has been diagnosed after 20 weeks or after 24 weeks, upper limit of abortion, upper limit to avail the abortion services as per MTP Amendment Act 2021 is 24 weeks, right. But say if it comes out that the fetus is anomalous and this type of fetus is not compatible for life after birth, and the pregnancy duration has already crossed 24 weeks, now what to do? Now also this Amendment Act says that yes, you can avail MTP services. You can avail MTP services irrespective of the gestational age, provided this abortion advice is being given by a medical board. And we will come to the medical board, who are the persons who are constituting the medical board, and they will decide whether this fetus is compatible to life, and if they feels that yes, termination of the pregnancy is for the benefit of the mother as well as the baby, then it can be done irrespective of the age of gestation. And then number 5 is maintaining privacy of the woman who is undergoing this abortion, and number 6 is contraceptive failure. Contraceptive failure, previously contraceptive failure as a cause was only for married couple. Now contraceptive failure can be a cause for availing the abortion services by both married and unmarried women, right. And this clause has been extended to the woman and her partner. So these are in a nutshell the amendments done in 2021. Coming to one by one. So the gestational age for MTP has increased from 20 to 24 weeks, and for whom the age limit has increased from 20 to 24 weeks, they are for the vulnerable women who are the survivors of rape, victims of incest, or say differently abled women or minors. There the age limit for MTP is 24 weeks. Okay. Next is the number of registered medical officer. So opinion of one registered medical practitioner is sufficient for pregnancy termination up to 20 weeks, and say if from 20 to 24 weeks we need to have the opinion of 2 registered medical practitioner before going for the MTP service. Coming to fetal anomalies, earlier it was only up to 20 weeks, but now there is no age limit, right? No limit to the gestational age, and if there is substantial fetal anomaly as diagnosed by the medical board. And what is the medical board? Every state or union territory should have a medical board, right? And what is the purpose? The purpose of this act is to exercise such powers and functions as may be prescribed by the rules made under this act. So, the medical board will have the powers, not the court. The court is not to decide whether the woman should go for the abortion in case the baby is anomalous. It is solely upon the decision of the medical board which will decide that yes, this is for the benefit of the mother or benefit of the baby. The baby, if it continues the pregnancy, then also we will not have a baby which will be compatible for life. So, it is better to go for abortion earlier. So, that decision is to be taken by the medical board, which consists of a gynecologist, a pediatrician, a radiologist or sonologist, and such other members as may be notified in the official gazette by the state government. If it is a state, then the state government or the union territory, as the case may be. So, this medical board should be present in every state, and in case it is required, if it is more than 24 weeks, the medical board is summoned and they will decide, they will look into the case, they will decide and give advice to that particular health facility to go on or to proceed with the MTP services for that woman, right. So, next, so that was regarding the fetal anomalies. Now, coming to the cause of abortion being failure of contraception. So, this earlier it was only for married women up to 20 weeks. Now, it has been this service, the failure of contraception being the cause of abortion, that has been extended to married as well as unmarried women up to 20 weeks. Patient confidentiality, privacy is to be maintained, right, very, very important. No registered medical practitioner shall reveal the name or other particulars of the woman whose pregnancy has been terminated except to the person authorized by the law. If the police asks, then you are bound to give the information. So, any person who is authorized by the law for the time being in force, there you can disclose, but not otherwise. And whoever violates these provisions will be punishable with imprisonment which may extend up to 1 year or with fine or both. Okay? So, that comes to the end of the MTP Amendment Act, where the summary is up to 20 weeks we need the opinion of one registered medical practitioner. From 20 to 24 weeks we need the opinion of 2 registered medical practitioner, and now the age limit has increased from 20 to 24 weeks. The upper age limit to avail the abortion practices has been increased from 20 to 24 weeks for the vulnerable woman, right. Then number 4 is irrespective of the duration of pregnancy, termination of pregnancy when needed or when necessitated by the diagnosis of any substantial fetal abnormalities. So, congenital fetal abnormality, if detected, then there is no upper limit for the gestational age, and it should be diagnosed and decided by the respective medical board, which is constituted by the state government or the union territory as the case may be. Lastly is protection of the privacy of the woman. The name, the particulars should not be disclosed to anyone except the person in authority, who have the power of law for the time being in force. So, or otherwise that care provider or the health provider is liable to imprisonment of as much as 1 year or with fine or your both. So, that is the amended MTP Act 2021. So, as you see, the age limit has increased. It has increased from 20 to 24 weeks. In case of fetal anomalies, there is no upper age limit for going for the abortion practices. Also, contraceptive failure being the cause of abortion has been extended to both married and unmarried women. So, all these taken together, India now stands among nations with a highly progressive law which allows legal abortions on a broad range of therapeutic, humanitarian and social grounds. And very, very important change now has been that you need not go to the court to get the order or to get the legally to get your permission to avail the abortion services. But you need to go to the medical board, and this medical board will decide. Right, the medical board which has been formed, they will decide whether the abortion services are needed for that pregnancy, for that woman, for the benefit of the woman or the fetus, right, even if the gestational age has crossed the maximum age limit of 24 weeks. Right. So, the power now has been shifted from the court, because court people will not be able to decide on the basis of the medical grounds. So, this medical board which has a gynecologist, a pediatrician, a sonologist, they are more sound, more proficient in this field, and they will be the persons to decide whether this continuation of pregnancy will jeopardize the health of the mother. That will not be beneficial for the baby. They will decide and they will give permission for the MTP practices. So, that was all regarding your abortion care. So, we are at the fag end of our this 3 months of course. We have discussed the antenatal, we have discussed the detailed anatomy, the pregnancy, how pregnancy occurs right from conception, fertilization. Then we have dealt with the antenatal care, the intrapartum care, the monitoring of the baby, monitoring of the mother during the labor process. We have dealt with the methods, the modes of delivery, the vaginal delivery, the cesarean section, and also the episiotomy repair, the sphincter injuries, the instrumental deliveries I have dealt, and also the postnatal care, the care during the puerperium, the different normal puerperial changes, the care, the postnatal care, and also the postpartum contraception. And in the last, we have discussed regarding the government health programs, right, which are related to maternal health, right. So, I presume that this course or this learning course has been enjoyable and productive for all of you, right. So, thank you all. And references for today's class has been taken from the Ministry of Health and Family Welfare, Government of India, and the National Health Mission with the Comprehensive Abortion Care Guidelines. So, thank you all. I hope all of you have a clear idea regarding this pregnancy and delivery. So, thank you.